Welcome all. I am Joy D. Calloway. I have the pleasure of serving as the Executive Director for the National Medical Association. We are pleased to present a book discussion and author interview highlighting We Are a Haunting by author Tyriek White. The National Medical Association is the largest and oldest national organization representing African American physicians, their patients, and communities in the United States. The NMA is a 501c3 national professional and scientific organization representing the interests of more than 50,000 Black physicians around the country. We are committed to improving the quality of health among minorities and disadvantaged people through its membership, professional development, community health education, advocacy, research, and partnerships with federal and private agencies. This event tonight is a co-production with the Bellevue Literary Review, an award-winning literary magazine that uses creative writing to explore health, illness, and healing. In addition to We Are a Haunting, which we will be discussing shortly, you can read Tyriek White's BLR story, Mushroom Death Suit, online. Allow me now to introduce our panelists for tonight. Tyriek Rashawn White is a writer, musician, and educator from Brooklyn, New York. He is the author of our novel tonight, We Are a Haunting, published in 2023 by Astra House. He is also the winner of the Center for Fiction's first novel award and was longlisted for the Brooklyn Public Library Book Prize. Tyriek has received fellowships from Calloway and the New York State Writers Institute, among other honors. He is currently the media director of Lamp Black Literary Foundation, which seeks to provide mutual aid and various resources to Black writers across the diaspora. He holds a degree in creative writing and Africana studies from Pitzer College, and most recently earned an MFA from the University of Mississippi. Tyriek, we are so excited to hear from you tonight. Our panelists will also include Dr. Danielle Ofri. She is the editor-in-chief of the Bellevue Literary Review. She's also a primary care doctor at Bellevue Hospital and a clinical professor of medicine at NYU. Her writing appears in The New Yorker, The New York Times, NEJM, and The Lancet. Her newest book is When We Do Harm, A Doctor Confronts Medical Error. Dr. Frank Clark is a board-certified adult outpatient psychiatrist at Prisma Health Upstate. He also serves as clinical associate professor at the University of South Carolina School of Medicine, Greenville, having chosen his professions after witnessing firsthand the impact that debilitating illnesses like Parkinson's disease and hypertension had on his personal family. Dr. Clark is a prolific poet who uses his creative side to provide a voice and raise awareness for issues pertaining to mental health, diversity, equity, and inclusion. He has collaborated with composers both nationally and internationally who have set his poetry to music. His works have been performed by the South Carolina Philharmonic. In addition to being the author of two children's books, Positively Haiku Part 1 and Positively Haiku Part 2, he inspires young minds and hearts through poetry and affirmations. He also serves on the board of the Bellevue Literary Review. With that, please welcome our panelists for this evening. Know that we have some set questions that we're going to go through, and then we're going to open the floor for our audience members to ask questions. Don't hold those questions, though, as they come up. Please do put them in our Q&A chat or put them on our Facebook page, and we will pull those questions for presentation at the appropriate time. With that, I have the pleasure of asking the first question on this fascinating book that I had the pleasure of reading to our author, Tyriek. Tell us how you became a writer. Start as far back as you need to.
Oh, okay. And just wanted to thank everyone for coming, everyone for checking us out tonight. Thank you to BLR and the National Medical Association. Thank you, Joy, Danielle, Frank, Jennifer, working everything behind the scenes. Just wanted to show y'all some love and appreciation. I first wanted to be a writer for as long as I can sort of remember. I always kind of participated in some sort of creative narrative sort of thing. I started out drawing, and then that kind of grew into wanting to be like a cartoonist and a comic and daydreaming about comic books. Um, and from there, I was lucky enough to, have teachers who sort of nurtured that side of me. Um, you know, uh, Suggesting, certain internships, taking a liking to kind of, I guess, how I wrote just basic kind of school essays. I'd always have like a creative sort of component to it, or an in. Um, and yeah, it like storytelling and telling, particularly, my story, and searching out my voice um was always sort of this lifelong kind of development. I used to go to this program in New York City called Urban Word NYC, and it largely focuses on, teen writing programs, youth poetry, open mics, slams. So I started sort of, writing poetry, um, informed by hip hop. I was a big hip hop head, and writing poetry sort of, it was a smooth transition. And yeah, and I used to, want sort of more in terms of like, I guess, searching for like what was my thing, because music is great. Music is something I always still to this day love. Poetry, I haven't wrote a poem in a minute, but it's something that lives and breathes inside of me in terms of even what I read a lot now, and informs a lot of the language of the novel. Um, but I was always searching, and I think high school, college, I kind of came to this, writing short stories, writing these fragments of narrative work, sort of based on my life, or my experiences, or my friends' lives, or my family's lives. And and from there, I kind of kind of stumbled around in terms of, all right, how do I kind of pursue this thing, this sort of thing that I can't exactly name. Um, and eventually, I found uh, some light at the end of the tunnel. A lot of my professors were renowned writers, luckily, and they put me on the right track. And then sort of that, finding that into the industry of writing, the business of writing, I guess that's an entirely other story. But yeah.
Well,
Thank
Tyriek,
you
that's
for that.
great to hear. And by the way, this is the book, folks. If you haven't seen it, it's a gorgeous cover and really wonderful. I've marked like dozens and dozens of parts that I just really love. I also want to show you what Bellevue Literary Review looks like. This is the issue that Tyreek's story, Mushroom Death Suit, was in. And really a year ago, kind of a year ago now, is when we were, putting this issue together, and we read that story and we were just blown away. And I happened to notice in Tyreek's bio that he has a novel coming out. And so that's when I grabbed the novel and was really excited to read it. So if anyone hasn't gotten the book yet, really don't waste too much time. Go out and get it. And we'll post a link to BLR's bookshop page, and you can buy the book and support an independent bookstore as well. And for me, one of the things that stands out so much in your novel is the immediacy of suffering, especially within the medical system, which of course is heartbreaking for those of us who are healthcare providers, but particularly in communities that have long been underserved and undernoticed. And the novel focuses really homes in on issues of maternal health, which really I think rings close to home for so many of us. And I'm wondering if you could read for us the part that begins, "Treasure lay to the side."
Okay. Yeah, yeah. Um, so this is uh so I should preface this story is mainly told in two voices. There's three, but it's mainly this sort of conversation between the son and his mother, who's passed away. And they have this sort of back and forth um across time, across space. Um, you could read each sort of chapter and section sort of as this kind of back and forth conversation. Um, and so, yeah. Treasure laid to the side as I kneaded the muscles of her lower back. Last minute checkup for preeclampsia. The aides took blood and urine from her, made us wait for what felt like hours. This is what the doctor recommends, the same nurse reiterated. There was a hierarchy in the way she said doctor, tugged at the end of the word with her teeth almost. Around us were folk left unattended on hospital beds and hallways, rooms with plastic curtains giving false sense of privacy, crowded waiting rooms with benches full of people who looked just like me. The ebb of equipment, the murmur of doctors, the groans of the sick, the bated breaths of the loved ones waiting along benches and walls, near half-lit vending machines. Grit collected at the corners of the walls, the ceiling edges, yellowed the machines and the counters and the beds. Treasure's man bought a boombox and played meditation music, drowned by the frenzy of the maternity ward. Finally, he headed down to the lobby in search of headphones. We call our hospitals what they are known for. I was born in Killer County. Everyone dies at Crookdale. When the Post reported a death in East New York and mentioned Brookdale Medical Center, we kissed our teeth. We knew all along how they patched up folk with gauze or tools still in them, misdiagnosed for convenience or expense, often broke people worse than when they got them. This is what the state gives us. After a while, a doctor came over and pulled Carrie and the husband to the side. We're so happy when girls have someone who knows what they're doing, an older nurse said to me, one we'd seen most frequently. Makes our job easier. There were different doctors than the one we had met for months. I was irritated, more than usual. My ears kept going in and out, like water was stuck in them. Med students flowed in and out, taking notes in folders and clipboards, watching patients as if behind a glass panel of a display case. I felt a murmuring, a swelling beneath the quiet, beneath the sweating, the uncovering, the expanding. When Treasure began to cry out, I could barely hear her. The nurses crowded her, but I heard another wailing, a scream so sharp I cowered before it. It wasn't Treasure. It wasn't the hundreds of women in the ward, all in various stages of birthing and degrees of pain. It was a sound that seemed to come from everywhere, drowning out the machines, the nurses' station, the med students, the crumpling of their scrubs. It sounded like a scream from a woman, or maybe a child, fighting over who would be heard. The sound, a lick of pain, and I covered my ears, jerked into the service cart, heard the clanging of equipment falling from a delivery tray. The same nurse who had been slowed by the swollenness in her feet grew sick of me and her way. She hurried me out the door and into the hallway. I sulked past a series of triage rooms, kept away from the nurse's station. Something passed through me, a chill or a sinking, like I had seen something I shouldn't have. Carrie probably thought I wasn't cut out for any of this. As soon as the pressure was on, I crumbled, and a room full of health professionals could attest to it. They hardly thought I deserved to be in that room anyway. Treasure wouldn't be alone, just with one less advocate whose motive was her well-being, not what was best for hospital business.
Very powerful passage, Tyreek, and good to fellowship with you all this evening. One of the things that, as you read it out loud, the statement "misdiagnosis for convenience or expense" really resonated with me, especially because we see this so much in our healthcare system in terms of the healthcare disparities. And with that, I was wondering if you could tell us about the research that you did to learn more about doulas and maternal mortality, as well as the inequities in our healthcare system.
It's a great question. So I did a lot of kind of personal research. So I sought out a lot of folk, and not that it was that many, but folk who I knew or had been referred to who had utilized the services of a doula, Black women in particular. I managed to uh, sit down with a actual Black doula herself and sort of ask these questions, you know, ask kind of what that advocacy sort of means and sort of the necessity, you know, how a doula sort of acts as this bridge, especially in a system or or structurally in, you know, a place that isn't the most sort of receptive or understanding of the issues of Black women, of women in general, you know, but mainly of Black women. Um, you see sort of um, postpartum care is something that's completely sort of neglected in sort of the medical industry. You see sort of um, women aren't listened to in the same capacity um, by health professionals. Um, and that number dwindles, especially with Black women. So, um, and you know, and you know, talking to someone who's, you know, about to give birth or going through this sort of process, you know, it's frightening. It's you know, it's full of anxiety, and especially if you know you're of color or you're a Black woman, you know, going into the situation where you know the numbers are sort of against you in terms of you know prenatal care, natal care, the actual pregnancy, um, you know, the death rate associated with Black women in particular during that process. So you know, I was a bit sort of ignorant in a lot of this, but sort of again watching kind of like friends of mine go through this, watching sort of family go through this. I was interested kind of in how do we kind of, I guess, meet this or meet sort of these issues, you know, kind of at the core, but also before, you know, we even get through the door of the hospital, you know, having someone there, having someone who because you know, like a lot sort of there's hundreds of thousands of people going through hospitals on a day-to-day basis and you know workers are overwhelmed, nurses are overwhelmed, doctors are overwhelmed. So to have someone, to have a an advocate, to have someone who knows your medical history, who knows kind of um, all of these things and can convey it to a doctor or can communicate these things, to me was incredible. And sort of having this character um, be a doula sort of at this doorway of life and also be able to see ghosts in a sense and be at this doorway of death kind of creates this cyclical kind of um, thing in terms of like how Black people, how Black bodies kind of um, I want to say are exposed to the system, but like how sort of thin that wall is, you know. Um, you know,
You know, if I can jump in here, I mean, I think for certainly for Frank and myself and other healthcare providers, you know, your descriptions really, you know, they're pretty strong and powerful. And you know, I just came across a paper just this week looking at the differences in mortality in breast cancer between women of color who suffer higher mortalities. But I saw one statistic that was fascinating, and it was for patients with stage 4, so advanced breast cancer. And they looked at states that had expanded Medicaid, you know, with Obamacare, that gap disappeared and it
mhm,
was able to be erased. And of course, the problem is many more fold complicated than that.
right,
But just seeing that you can make progress was both like inspiring that we can do something. And I think doulas are important. And as a primary care doctor, I feel like everyone should have a doula, you know, going through the hospitals, going through serious illness, chronic illness. We
right,
should definitely have that. I actually wanted to turn the conversation to craft for a bit. As an editor, I'm always fascinated by craft, and
for
this novel
sure.
has quite an unusual structure with, you know, multiple narrators and multiple time frames. And I was wondering, how did you come up with that structure? And more importantly, how did you manage to stay within its complexities without losing your mind?
Well, I don't know about that last part, but I was sort of, and this went through a lot of different processes in revision, in editing. I definitely played with the form, with sort of the point A, point B, point C, the kind of timeline. Definitely played around with it during the kind of this post period where I gotten everything I could possibly get out. Um, and from there, it was sort of um consistently this like pushback against sort of this Western kind of ideology of everything must have a beginning, middle, end, right? Or time must be this sort of linear thing, right? Um, a lot of things in this novel are again this kind of cyclical sort of nature of things, just like kind of the reaches of structural racism, the kind of loops or time loops we find throughout history in terms of like history repeating itself in a sense. Um, so it was important to me to kind of create this rhythm and this ebb and flow that was fractured, that was disjointed, that wasn't this kind of straight through line. Um, and a lot of kind of the back and forth stems with what each kind of chapter um, is trying to say or saying, you know, in a way that isn't completely straightforward or hinting at or thematically, um, finding which chapters or which sections kind of speak back to each other, um, and finding the resonance there. Um, so we see kind of the beginning of Kali, who's the main character, this young kid who's just lost his mother, Key, this doula, and he's sort of seeking out answers for how to process this, how to deal with this, um, while also growing up in kind of government housing and the trappings of, um, East New York, Brooklyn, in the early 2000s. Um, so his kind of inception and seeing kind of Key for the first time in this ghost form uh, speaks back or, is right before the chapter where Key, his mom, kind of discovers her gift, right? So we see these kind of mirrors held up in each chapter. And I wanted to, you know, not only track Kali's kind of coming of age as a young black man in New York, but also kind of his mom's sort of coming of age, her sort of growing from this kind of young adult who's, you know, boosting clothes from her job at the department store to this transition of becoming this kind of doula, this healer, this seer for her community, and kind of putting these trajectories and right next to each other, and hopefully, I think the effect is that Kali learns to deal with his grief through kind of confronting it face on and um, kind of heeding this conversation, heeding the words of his mother, even though she isn't here anymore, and holding on to that.
Yeah, and I'll just point out for the folks who are writers in the audience or even just readers, what I think Tyriek described is really common, that authors will often write a story, write a novel, and then go back and sort of tear it up and re-braid in the narratives and stories. And so there's often several lives of a book till you actually read it on the page. And even though the narrative may be chunked up in different ways, it may feel very logical emotionally because we experience life in these jagged ways, but it feels completely smooth. And so the novel reads smoothly, even though it's actually been, redirected a few times.
Mhm.
So Tariq, you all of us here are connected to healthcare in one way or another, and you had mentioned about restorative healing in communities. And I was curious if you could talk about how we might find alternate ways of healing, of improving how hospitals or healthcare centers engage with the communities they're in.
Hmm. Oh, that's such a incredible question. I feel um I read about sort of this hospital, or not even hospital, but this kind of health group in Minneapolis. And it's based around this idea of the people's theory of sickness, right? And it's sort of this community-based sort of initiative that approaches healing and sort of restorative health as a response to um, particular kind of social and cultural um, ailments or sicknesses, right? So you could say the kind of Western capitalist sort of idea of individualism, right, is inherently, um, it inherently creates tension with, you know, sort of, think about our communities. Our communities are very communal. Our communities thrive on sort of, mutual aid, sort of giving back, of sort of these rituals that involve, the group, the family, looking at the world through a framework that doesn't censor the self, right? Which often, in kind of this like postmodern sort of say post-Trump kind of world, like more than ever, people are, you know, sort of driven by individualistic values. Um, you think about again the sort of theft of sort of communal spaces, or not even spaces, but just places, and where, you know, people of oppressed and underrepresented identities can be in community healthily. Um, I think it also begins in sort of the things that we fund, right? Thinking of it um, sort of personally, I was born sort of, with sickle cell, which is a very particular kind of um, immunocompromised condition in the African American community. So a lot of my exchanges or dealings with doctors or hospitals has been um, drug seeking behavior, or, this person is exhibiting this kind of, you know, you, the pain threshold, right? So like, and this relates to the short story I submitted for BLR, um, but that, you know, the different kind of, you know, walking into a hospital, and as a black man or a black woman, um, just off the rip having your pain threshold heightened. So when you ask for drugs or painkillers for something to help you, it's considered this, or it's considered drug seeking behavior. It's taken completely out of context, and is if that's a perhaps it's a racial dynamic, perhaps it's, I think I know what it is. But I say that to say that kind of restorative justice looks like, to me, people who are knowledgeable of sickle cell and how it specifically affects people in the Black community, how this affects Black children, um, how kind of the outreach of, you know, hospitals or medical centers could look differently if sort of they were aware of the communities that they serviced. So if, I'm in a largely Black community, um, I service mainly Black people or brown people or the sort, offering outreach that specifically targets people with sickle cell or targets people with high blood pressure or targets, all of the sort of ailments that kind of plague our community, um, sort of meeting it head on in terms of, not preventative, you can't, sickle cell is passed down, but those other things can be a sort of preventative engagement or education or offering resources or um, so for me, I think like, as a kid, I just wanted more information, you know, from the people who serviced my community. I just wanted more um yeah, sort of information or access to said resources. But instead, um, I was often met with kind of, um, not pushback, but inconsistent sort of um, engagement with me as, a Black kid living in this neighborhood afflicted with sickle cell. So I guess I would expand this, I would expand that model, right? Um, and just um, that focus on engaging with a community and whether that's going into a community and finding ways in which that looks, like, um, not like this sort of white savior idea, but, but being able to sort of have an entryway or entry point into communities to provide preventative information or provide resources or, you know, stuff like that. I think
Yeah, I'll
that's
jump
what
in and
that
put
looks
the
like.
plug that if you haven't read the story Mushroom Death Suit in this issue of BLR, it's really powerful. And for me, as an editor, I was taken by the story, but as a physician, having treated many patients, especially during my training with sickle cell, it really resonated. And and I remember, I just want to even read you just a quote. One of the reviewers said about the story: "I found the language of this piece stunning, lyrical and inventive and full of energy, with many lines that stopped me cold." Here's one line: "I heave my lungs up over a jagged hill." And boy, did that describe, breathing heavy. Another quote was, "Praying for land. I don't want to drown in what I really am." And so the story was really amazing. But in the cover
Thank you.
letter, when you submitted the story, you wrote, "My commitment as a writer is devoted to contextualizing the everyday happenings of working class folk, developing models of agency, love, and joy within the structural violence of the US." And I wonder if you could tell us a bit more about contextualizing. And I'm particularly interested in the idea of agency, but also love and joy.
Mm, yeah. Um, so a lot of my work is, centered around the kind of everyday happenings of people who kind of are affected by sort of structural inequalities or are a part of underrepresented communities. Um, so my goal is always, not how to humanize these characters, because to me they are, that work doesn't need to be done. For me, it's, finding a life outside of that, right? So what does that life look like outside of all of these kind of systemic kind of issues, right? So, a lot of it is seeking out the joy in these characters' lives. A lot of it is seeking out kind of, you know, the things that they love, the things that they enjoy, the things that um engage them. And that, starts at characterization, right? That starts at like creating an embodied kind of archive around these characters. What kind of music do they like? What kind of food do they like? What kind of art do they consume? Um, and from there, sort of, arranges itself into how these characters see the world, right? Their framework from which they view the world out of. And I think in that is a sort of autonomy, is a sort of agency that you know, being able to kind of depict these characters um who are burdened, right? But to be able to revel in kind of a family dinner, or to revel in just two teens hanging out and having, you know, completely normal conversations, to me is, you know, powerful within itself. Excuse me. Um,
You know, we were talking just before the event started, and I had just finished today reading Heaven and Earth Grocery Store by James McBride. And, you know, as you're speaking about that, it really has a parallel in his characters. If you haven't read the book, it's fantastic. But really being able to combine joy and agency and love with the context of lives with pain and suffering in a
mhm,
way that's so profoundly human. I mean, so often we just have an image of here's the suffering character and here's the joyful character, but in fact, most characters, most people have elements of all of them,
right.
and that just it resonates so much because you know it's aspects of us that we see in the characters.
Mhm,
So, Tyreek, I wanted to touch on something, especially Key's character. She resonated with me for a number of reasons, as well as Kali. But she seems to be someone who's kind of searching for a space that allows her to be vulnerable and authentic. And I was curious, especially given that I think we all share the love of the arts and humanities. How do you think the arts and humanities can help foster that safe space for individuals who can relate to aspects of her character?
mm, It's a good question. I think sort of right, that receptance, that empathy, allowing folk to be seen. Do you mean sort of in this in a practical way, or more of a esoteric way? Ah,
Practical.
right. Um, I so you know, my my many jaunts as a as a kid who spent time in, you know, children's wards, um, you know, due to like pneumonia, you know, based off of sickle cell related complications. Um, I would have loved, and I feel like there were aspects, but like I would have loved like a reading component to that, or like a reading, like a access to sort of library in those youth wards, right? Or I remember um I used to go to I don't even know if it exists anymore, but it used to be this camp for kids with uh sickle cell, HIV, other, you know, autoimmune sort of disorders, right? And they take us upstate and we'd get to, you know, camp and um do obstacle courses, you know, that sort of thing. And it was amazing. Um, and I also think sort of programming in a similar sense where there can be a way of introducing kids to books, or introducing kids to story or other forms of storytelling, you know, other art forms with strong uh voices, you know, so the kids kind of, you know, relate to that. And I don't want to, you know, sort of reduce it to kind of youth programs and all of this, but I'm thinking sort of from that perspective, right? um but yeah, I feel there's so many opportunities to kind of relieve kind of the feeling, or the experience of being in a hospital, right? Especially if you're there for, you know, a few days. I feel like that's a direct kind of way to sort of introduce some of these things. Um,
Great. I mean, we're going to turn in a minute to our audience Q&A. And so if you have questions on your mind, now's the time to put them in. You know, in your book, the character Key, she sneaks out to Strand bookstore during her lunch hour every day. I want to know if that was you.
Mhm.
And then to kind of to dovetail what you're just saying, what role do books and stories play in your life?
Um, it is me to a degree. I used to take art classes at SVA. So that's like 23rd. So
School of Visual Arts.
right, School of Visual Arts. So there was a bookstore that around there at the time, but it wasn't Strand. But um all the times I used to be
It
able to
was
get to,
Shakespeare and Company on 23rd Street, but it closed.
right, right. I think that's it. Yeah, so but I was always a patron of Strand, and um it was always bookstores always since I was a teenager offered me a place of solace, right? Um even if even beyond, even before we even get to the actual getting a book and opening it, just being in a space, a bookstore space, and finding a corner, um, and just spending hours, reading books, reading the back of books, reading the first pages of books, um, was, you know, formative to, just me and who I am. Um, but I think those stories and those narratives play such an important role in that I was able to sort of find through sort of seeking out characters and stories that I related to. I was able to find the words and language and techniques to kind of write what was inside of me, right? So that's why I guess you want to become a writer, people banging into your head to read, but it is true. I figured out how to construct a world, um, to make sense of my world, um, and to make sense of sort of the things going on around me, um, and and I was able to sort of work through it, right, and make something of of a kind of a worldview or a perspective that I could understand. It helped me understand myself in relationship to the world. So I think even if you don't consider yourself a writer, I think we're all storytellers, or we come from a lineage of storytellers. We all sit um, at the bosom of our grandparents, right, and listen to them tell stories, or our teachers or our community leaders. Um, so storytelling and narratives are vital, I think, to how we tell the story of ourselves, and also how we begin to tell the stories of this world, but like beyond this kind of singular uh kind of thing. That's history, right?
Thank you all so much. We're going to turn now our attention to the audience questions that we have received, and we've received a few. We'll get through as many of them as we can. Do have to take this moment to say what a fascinating read this was for me, Tyreek. I really appreciate the opportunity to have gotten into the world of these characters, and this was fascinating for so many reasons. As someone who is still sitting in the place of grief of after losing my mother, as an aspiring writer, as somebody that just needs to sit still and really fall into the layers of these characters and fall into just the expanse of words and how you did it. It was really good to escape for me. And that's one of the things that the National Medical Association is hoping that our physicians do. It's called self-care, to steal away and sit in a corner and read a book that it doesn't have anything to do with your work. So we are encouraging this. I'm so excited that we could offer this book discussion. So with that, let's move into some of our audience questions for the balance of our time. The first one, Tyreek, thank you for your beautiful, soulful, that's the word, writing and reading. Treasure Laid to the Side. I'm a psychiatrist at SUNY Downstate and Kings County Hospital. Can you offer suggestions in your voice to my medical students and residents to help them listen better and bridge gaps in communication? Interesting question, Tyreek.
Yeah, wow. I love that. That's such a great question. And thank you for the comment. Um, there's that again, there's empathy, right? And which I feel like we all share that, right? And whether you're working in humanities or you're working in medicine, you know, we all seek to improve the lives of the people we serve, right? Um, so, you know, I the reason a lot of this book is told from this sort of perspective of processing grief, right? Kali um, is seeking out these answers, right? So I think um, cues for, you know, a fictional character, but I think the cues for him is kind of his relationship to food in a way, right? There's moments where people ask him, "Have you eaten? Have you eaten? Have you eaten?" And you know, he either, you know, flicks it away or, you know, answers or sometimes untruthfully. Um, so for me, you know, being able to track that kind of you know, he's not eating because he's sad, he's depressed. And that sort of manifests in other, you know, ways too. Some people um it's the opposite, right? It's the other way. Um, but you know, sort of being able to tune in or tap into a lot of these signs. Um, I mean, and a lot of his kind of music taste is sort of um, self-loathing or self-deprecating. The reason I love kind of the placement of Suicidal Thoughts by Biggie Smalls is because, you know, in the context of this kind of you know, working class black community, you know, we don't really talk about suicide. Um, and there's this moment, there's this grappling with this character and this song that he's playing that he like relates to the bravado, but also the vulnerability of it. Um, so I think, and even kind of the aesthetic choices we make, the art, the things we like, the things we sort of disassociate away from. Um, all of these things are minuscule, and you know, if we could detect them all the time, we would save so many people, but it's hard, it's difficult.
Thank you.
s- so
Could I
yeah.
dovetail on that? One thing
Yeah.
that I took from the book is hearing people's stories, and but not just the top layer of the story, that there are many layers of the stories. And I think with, you know, communicating with people we may not have things in common with, giving them the chance to share that story and maybe the stories behind the stories as well, and hearing the many voices that fill into a story, you know, just allows you to really enter that person's world.
Indeed, indeed. Here's our next one. Congratulations, Tyreek, and thank you for letting us dissect your brain. I wanted you to read the first paragraph of your prologue, please. It really drew me into the book. It was kind of a metaphor for physician burnout to me. I know that
Mm,
was not where you were going and what you were going for, but please break down the paragraph for us. Backward into a scar in the world, traveling across a pulse that could split me down the middle. Congratulations again, outstanding. Interested in your thoughts on this part.
mm. Should I read it or should I just uh one day I fell backward into a scar in the world, a fall sudden and lasting. A portal took me whole, sent me traveling across a pulse that could split me down the middle. I tumbled out the other side, a terrible moaning like a hive of meat bees. Um, yeah, that's such a interesting interpretation of that. I would love to hear more how, you know, how you made that assertion. Um, for me, I think this first um paragraph kind of sets up, you know, the character. It does a lot. It sets up sort of how I kind of want the reader to move throughout this book. Already it kind of eschews time and linear sort of temporal movement, um and space. It defies space. There's, you know, we're talking portals, we're talking dimensions. It's almost a bit sci-fi, right? But I really wanted to kind of symbolize, you know, how it feels, you know, sometimes to be Black in this country or underrepresented in this country, right? Because you have this, you know, you have this character, nameless so far, who is pulled back, you know, we don't know against their will or not, um, into time, into moments in time, into fragments in time. And sometimes, you know, being Black in this country is being confronted with sort of the history uh, laid upon you, right? Is sort of the outer body experience of seeing sort of traversing your streets and seeing the street signs named after slave owners. That sort of cognitive dissonance, of the experience of constantly living, you know, um, dealing or confronted with, you know, your history, your lived experience, and how people kind of view you in that history.
Mm. That moving back between portals was very reminiscent of like a kindred type of experience. It was really cool.
Yeah,
Here's
yeah.
one. When you
Big
write about
inspiration.
topics, I'm sorry, excuse me, go ahead,
No,
Tyreek.
I was just saying big inspiration.
Yeah.
Kindred. That's my joint.
When you write about topics that are deeply personal to you, such as illness or systemic injustice, how do you dip into the pain and the emotions in order to write about them, but also know how to stop when it gets too much? Do you have to get into a certain headspace? Do you have any rituals? Please share and thank you.
Mm, yeah. Yeah, it's difficult. I don't know if I'll ever fully kind of be able to control that separation, but you know, you do try and live in a moment, right? You do try and, you know, confront a moment, to soak yourself in it, to be in a place. You know, I like to write kind of three-dimensionally, which is, you know, just all of the senses. You know, what does the character smell, feel, taste, you know, all of these kind of things. Um, I try to be in that moment. Um, and then maybe I'll worry about being objective kind of after, when I'm revising, right? Um, and keeping that healthy distance sometimes, because, you know, even your editing, you're constantly reliving this moment, or this, or it's triggering these kind of feelings and emotions. um I think I try and, one, you know, I'm not as consistent as I'd like to be, but you know, I do sort of meditate, or at least sit in quietness, or peace, um especially afterwards, because I don't want to just go back into my life, you know, with these emotions and these, you know, these thoughts. So I think having some time to yourself, and it might seem like the writing is that time, but the writing is the work.
Lord.
So having that time to yourself, whether it's before, whether it's after, um, and then, you know, having a way to kind of disconnect, in a sense, or distance yourself, right? So
Thank
whether
you.
it's,
I don't think people realize the need to disconnect from what we love and enjoy, and I'm sure you enjoy it as well, but it's also the work and it pulls from you. Our last question, and we'll have a couple closing comments. We really appreciate everyone being here tonight. You've mentioned how your work is in conversation with the likes of Baldwin and Morrison. Are there new voices or writers that you're channeling into your next project?
Joseph Earl Thomas just wrote a memoir called Sink. Um, Incredible, you know, sort of similar vein, um, of young Black folk growing up. That always sort of gets to me. Latoya Watkins, Dr. Latoya Watkins, who wrote Holler Child. I think a lot of her work is based in like, the South and Texas and stuff like that. Beautiful writer. Tracy Rose Payton, Jamila Minix. There's so many, so many people doing their thing right now. So, yeah.
Glad to know you're still being inspired. Well, Tyreek, really want to thank you for this experience.
Thank
Thank
you.
Dr. Frank Clark. Thanks, Dr. Danielle Ofri. You can purchase your copy. We are haunting at BLR's bookshop. We have put it in the chat, but we're hopeful that you will buy the book. You also can subscribe to the Bellevue Literary Review, and because you are a National Medical Association member, get a discount there. That's also in the chat. We'll put that on Facebook. There are a number of activities and events that are coming up with the National Medical Association that will be on our social media pages, not the least of which is our health policy colloquium that's coming up April 11th through the 14th. Really excited to invite you there. I'd like to turn over the microphone for the last moment or so to Dr. Ofri, who will share some of the upcoming events for BLR. Thank you all again for being with us tonight. Dr. Ofri.
Sure. And for those of you who are fans of Black Man in a White Coat, Damon Tweedy, who's BLR's nonfiction editor, he has a new book coming out called Facing the Unseen, Centering Mental Health into General Medicine. And we're excited to celebrate an event with him on May 6th. And I'll just close with the poet Edward Hirsch, who, if you don't know, he's a fantastic poet, also the president of the Guggenheim Foundation. He said in one of our interviews that literary magazines tell you the news. And the news is, who are the new writers out there? We found Tyriek White in here. We didn't know about him until we read him there. And many of our readers discovered him through here. There are lots of writers in this issue of BLR on the theme of taking care. And so I'd encourage you, in addition to buying books, check out some literary magazines. BLR is one, by no means, the only one, but that's a place to meet the new folks coming up, the new voices. And these will be the authors of the books that are going to move you, and that your kids will be reading in school when they get around to it. So thank you, Tyriek White, for writing this beautiful book, for publishing your story with us. Thank you, Dr. Frank Clark, and thank you, Joy Calloway and the National Medical Association. And we'll see you all at the next event. Good night.
Good night.
Good night, everyone.